My name is Brenda Bennett, and I'm going to talk to you today about Gaucher's disease. It looks like Gaucher, but it is pronounced Gaucher. Hopefully by the end of this presentation you'll understand what it is, how it's transmitted, and the quality of life and treatment of people that have it. Okay. Gaucher's disease is the result of an enzyme deficiency which allows old cells to be stored in the body instead of being expelled. Normally, old cells are removed by macrophages, and this occurs in the digestive organelle in a cell called lysosomes. These words are so hard for me. Within the lysosome, the enzyme, don't go, glucocerebrosidase is broken down, and people with Gaucher's disease do not have this enzyme, so they can't break down glucocerebrosidase. And it builds up in the cell, and then wherever the cells are in the body, those parts become enlarged. And it can infect various parts of the body: the nervous system, the lymphatic system, the skin, the lungs, the liver, spleen. Liver and spleen are really common. It can also infect the bone marrow and the bones themselves. Now, this is just a picture of a Gaucher cell that's enlarged. Okay, Gaucher disease can affect anybody, regardless of race, regardless of ethnicity or gender. It's not linked to the sex chromosome, so it affects males and females both. However, it's the most common of people of Eastern and Central European Jewish heritage, with 1 in 450 people affected, compared to the general population where only 1 in 100,000 people are affected. So that's a pretty good chance. All right, the chance of inheriting Gaucher's disease. There's 5 scenarios in which you can inherit Gaucher's disease. One parent can have a normal gene, and another parent can just be a carrier. If that's the case, then their children have a 50% chance of being a carrier. If both parents are carriers, there's a 25% chance that the child will be a carrier and a 25% chance that they won't be a carrier. But there's also a 50% chance that they will actually have the disease. If one parent has a normal gene and the other parent has Gaucher's disease, then the children will be carriers. There's a 100% chance that they will be carriers. Then if one parent is a carrier and one parent has the disease, it's 50-50 chance that the children will be a carrier or have the disease. And then finally, if both parents have Gaucher's disease, then all of their children will have Gaucher's disease. But I don't know if 2 parents, I don't know if they would have a child if they knew that they would be passing that down. That seems like it would be pretty rare. I didn't find any statistics on it. Okay, there's 3 subtypes of Gaucher's disease. Type 1 is the most common, and it does not affect the central nervous system. It can range from very few symptoms to severe, but it mostly consists of the organs being enlarged, and it's non-neuropathic. Type 2 is the most severe. It has the earliest onset. It affects children it is diagnosed in children between 3 and 6 months, and it does affect the nervous system, the central nervous system. It affects the brain stem. So these children suffer from apneic problems. They're unable to swallow properly, so they can't get proper nutrition, which causes problems of its own. They always die, generally by the time they're age 2, but the average is about 9 months. And then type 3 also affects the central nervous system, but the onset is later. It can happen in children or in adults, and the central nervous system is not affected as severely. It's usually displayed as abnormal eye movement or delay in growth, but it doesn't cause the breathing problems and the swallowing problems that the babies have when they have it. So it's labeled as chronic. Treatment. First off, just a simple blood test can be used to diagnose Gaucher's disease. The most common treatment right now is enzyme replacement therapy, which became available in 1991, and it's used for type 1 and type 3. It does not reverse the damage to the central nervous system, but over time it will reintroduce the, how did you say that word? The big enzyme, glucocerebrosidase. That will build back up in the body and allow the cells to remove the dead or old cells from the body, so that the liver will go down, the spleen will go down, all the swelling areas will go down. But the type 2, the babies, enzyme replacement therapy is not recommended for them because their central nervous system damage is just too bad, so it's not going to help them. There is also, in really rare cases, bone marrow treatment, which can effectively cure the disease, but the availability of donors is really small, which seems kind of odd to me too, but there's not that many donors, and the procedure has a lot of risks, so they don't use it very often. And it's not on this slide, but the last way to treat it is gene therapy, gene replacement, and there is a doctor whose name is Roscoe Brady. Yeah. Dr. Roscoe Brady, and he is at the National Institute of Health. In 1995, he was able to complete gene therapy on a person, and it was successful. However, red tape, I'm not sure why, because I couldn't find any information. It's just still in clinical trials even all these years later. So it's still not commonly used, it's not approved by the FDA, but it does work. So I guess eventually they'll get there, and that will be the mode of treatment for Gaucher's disease. There's references. Thank you.